Any questions or comments for me before we get started? Nothing? Feeling like Mondays? Okay, well, this is the last week of this class. That's kind of crazy. And then the end of this week, we start SUR 120. So we're going to take the last hour to kind of go over what SUR 120 is going to look like on Friday. And then we'll dive in head first on Monday. So what I'm looking at right now is 1 day of synchronous lecture, which would be Mondays. And then Tuesday through Friday, you will be left to your own devices to watch the recorded lecture and do some other activities. And then that's going to give every group the opportunity to spend a full 4 hours each week on campus in lab. So, Group A will have Tuesday, Group B will have Wednesday, so on and so forth through Friday. SUR 120, there are a lot of skills. All of our basic skills, same groups, Rainey, yes. All of our basic skills are coming down the pike in SUR 120, so it's going to be a lot. But it's going to be fun, and it's just a starting point for our basic skills. So we're going to practice them as we go throughout the rest of the program, but this is just kind of starting that foundation. So we'll learn everything, we'll practice everything for the preoperative, opening of all of our sterile supplies, scrubbing, gowning, gloving, setting up, doing our initial count, receiving some fluids onto the field, labeling them, gowning and gloving the surgeon, draping, passing some in, moving up to the field, passing instruments. Okay, so there is a lot that we have to learn, and each of you will have 16 hours in lab to learn them. 4 weeks and some change. So 4 full weeks, and then we end on a Tuesday of that 15th week, but you will have 4 lab sessions, each 4 hours long. So, we've talked about a lot of these things already, and I know, like as Ian has mentioned before, watching it and talking about it's different than doing it, but this is that third piece that's going to come in. So continue to review your sterile principles and practices, because if you know those by memory, that's going to help you when we start opening and applying sterile technique and all of those fun things. So I'm so excited to be able to take this next step in your journey with you. It's going to be really awesome. I'm super excited. So that's kind of what we're looking like for the plan. So I'm hoping to firm up everything, finish up the grading, and get SUR 120, finish planning everything out today. Fingers crossed. So that's kind of what we're looking at coming down the line. And then that'll finish up our semester, and we'll get a much deserved week break, all right, before we come back and pick it up with, I think pharmacology starts. Those of you that had the opportunity to be in the teaching demo with Jessica, we did hire her. She accepted our offer, so we're really excited that she's going to be joining us. Her first day will be September 7th, so it'll be a little bit before she joins us, but you'll start seeing her face. She'll start shadowing in our classes while she's doing her onboarding. Okay, so expect to see her in the near future. Let's see, what else do I have to say? Tomorrow, threaded discussion for week 4. Your initial response is due. We have a instrument quiz coming up on Wednesday, which will be your plastics quiz, and then final exam on Friday. That's going to be 125 questions. So each of them are just a little less than 1 point apiece. And that's going to cover chapters 5, 6, 15, 18, and 19, all the chapters that we've gone over. The final will not include instruments. No, not specifically. So you're good there. Other questions after I rambled on about all of that stuff? Blah, 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 blah. Do you hear like on Peanuts, like wah, wah, wah? Do you guys hear that when I'm talking? Okay. All right, so we're gonna watch some exciting videos. First, let me start by asking you a couple questions about vitals. How long will we record like pulse and respirations? How long do we record those things? Especially if it's a baseline. Let's go with a baseline. 60
Yeah, 1 full minute, the first one.
Yep, 1 full minute. You got it. So we're going to do that for 1 full minute. My vision is to set up stations in the classroom. We'll be in the classroom Tuesday and Thursday because they're doing terminal checkoffs in the lab. So let's all meet in the classroom when you come to campus this week. Like I said, I'll have vital stations set up and then probably pair you up as best as I can, and you can just cycle through taking turns, taking each other's vitals. It shouldn't be too crazy. So 60 seconds. All right, so before we take someone's vital signs, what are some things that we need to do?
Have them seated, legs not crossed, relaxed. You know, ask them questions about, I don't know, I'm thinking about when I've been at work, so I don't know if that applies to all of these situations.
Yeah, probably. If we're like in a clinic setting, for sure. You know, you want to make sure that they're sitting, they're rested. And then let's see, Tammy and Rulan said confirm the patient's identity. So that's a good thing too. We want to just ask them their name or confirm their name. Yeah, make sure we have all of our stuff ready and that it's working, right? Introduce ourselves, explain what we're doing. Yes, yes, yes. Right size cuff, exactly. Perfect. What is there anything we need to do to our hands first? Lick them and then stick them on the patient. So we want to wash them, right? We want to wash our hands, and we want to put on some exam gloves, all right, before we touch the patient. Okay, yeah, I think we about covered it. Good job. All right, so the, hold on, I don't want to tell you a lie. Let me see which vitals we're going to look at first. I'm having trouble with my cursor today. I don't know, it doesn't want to stay. Okay, so first we're going to watch a video about a variety of different ways to take temperatures. What is the normal temperature? (97.3) Jacob says. 98.6, a few of you say. So the book says the normal oral temperature is 98.6, and then if you're doing like a temporal temperature, then that's going to vary a little bit, as well as the tympanic temperature. So around 98.6-ish. If we're above 100, then we're going to report that the patient has a temperature. Or I think in the video that we're going to watch, she says 100.4, which is what we're using for our COVID situation, right? Okay. Let us, my cursor is really irritating me. I don't know why seems to keep disappearing. Okay. It's only since my computer restarted or re-updated or whatever that it's being weird. Okay, stand by. Almost there. Just trying to get my chat box here, so if you guys have questions, you can see those. Okay, this is our favorite lady that put in the catheter, but I think she does a better job with temperature. We'll see what you guys think.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to show you 6 different ways on how to check a temperature. First, let's talk about what is a normal body temperature. In the adult, it can vary anywhere between 97 degrees to 99 degrees Fahrenheit, with the average about 98.6. In a child, it can also vary anywhere between 97.4 to around 100 degrees Fahrenheit. And anything greater than 100.4 is considered a fever in both the adult and child. The first way we're going to check a temperature is through the mouth, so orally. And you can do this one of 2 ways. You can use a digital thermometer, which is most commonly used, or you can use a glass thermometer, which really isn't used as much because they can break. So let me show you first how to use this glass thermometer. Before taking an oral temperature, you want to make sure that the person hasn't consumed anything. And if they have, wait about 15 minutes before taking the temperature. So what you want to do is you want to perform hand hygiene and don gloves. Anytime you're taking an oral temperature, you may be encountering oral secretions, so you want to prevent yourself from getting contaminated. Then you want to make sure your thermometer is clean. So clean it with alcohol prep and let it dry. Now, with glass thermometers, you have to pay attention to where the liquid is on the reading scale. If it is above 98.6 degrees Fahrenheit, you will have to take your wrist and flick the thermometer down for that fluid to go below 98.6 degrees. Once the fluid in the thermometer is below that point, you'll want to insert the thermometer in a probe cover just to protect the thermometer from being contaminated anymore. And then take the thermometer and insert it in the patient's mouth. Have the patient lift up their tongue and put it underneath the tongue.
This guy looks really excited.
And wait for 3 minutes and then remove the thermometer. Once the time's up, you'll take the thermometer out of the patient's mouth and read the thermometer. Then what you'll want to do is remove the probe cover, clean your thermometer with alcohol prep or whatever your facility wants you to clean it with, doff your gloves, perform hand hygiene, and document the temperature, especially the route. Now let me show you how to check an oral temperature using a digital thermometer. Of course, what you want to do first is perform hand hygiene and don gloves. And make sure you're working with a clean thermometer, so always clean it with alcohol prep. Then you're going to take the thermometer and insert it in its probe cover. Then turn the thermometer on by hitting the button on the thermometer and insert it in the patient's mouth. Have the patient lift up the tongue and then put it over and then keep the mouth closed. And then once the thermometer is done, it will beep. Once the thermometer beeps, take the thermometer out of the patient's mouth and read it. Then when you're done taking the temperature, be sure to remove the probe cover, clean the thermometer per your facility's protocol with alcohol prep, and doff your gloves, perform hand hygiene, and document the temperature. Another way you can take a temperature is through the ear via the tympanic membrane. So first, what you want to do, of course, is perform hand hygiene, get your thermometer, and with these type of thermometers, you want to use a probe filter. So place that just over the thermometer. Turn your thermometer on, and you're going to insert this in the ear. For the adult, what you'll want to do is you want to take the pinna of the ear, pull it up and back. If your patient was less than 12 months of age, you would want to take the pinna and pull it down and back. So we're going to pull it up and back. We're going to insert the thermometer in the ear.
That's probably her child.
To take the temperature, it just takes a second. Then we will read our thermometer, and it will display the temperature right here. Then after reading the temperature, what you want to do is take the probe filter off and perform hand hygiene and clean your thermometer per your facility's protocol and document the temperature. A third way to take a temperature is through the armpit, the axilla. So to do that, what you want to do is get a digital thermometer, perform hand hygiene, make sure your thermometer is clean, and insert it into a probe cover. Then turn the thermometer on and lift up the person's arm. Place the tip of the thermometer directly into the armpit, not on the clothing.
Stab it
Have
in the
them
armpit.
close the armpit and hold the thermometer there until it beeps. Once the thermometer beeps, take it out
So this is when I worked in labor and delivery, this is how we take infants' temperature is in the axilla.
and read it. After reading the thermometer reading, take the probe cover off, clean the thermometer, perform hand hygiene, and document. Another way to take a temperature is through the temporal artery. So to do that, of course, we want to perform hand hygiene, get our thermometer, and with this specific thermometer, it has a cap cover, so take it off. It does not have the little filters that go over it. Some models do. The manufacturer just recommends cleaning the thermometer. So make sure your thermometer is clean with alcohol prep or whatever your facility requires you to do. What we're going to do is we're going to hold in this button, keep it held. We're going to go to the middle of the forehead and swipe the thermometer across the forehead to the hairline and then release the button and read our temperature. Now, let's say that the patient was sweating, had a lot of sweat on their forehead. How we'd want to do that is, again, hold the button in, go to the middle of the forehead, sweep across to the hairline, and then go behind the ear and read our thermometer. Then clean your thermometer, recap it with the protective cover, perform hand hygiene, and document. Another way to check a temperature is rectally. So to do that, you want to perform hand hygiene and don gloves when checking a temperature this way. You want to get a thermometer and you want to make sure it's clean. Then insert the thermometer into a probe cover and then lubricate the tip of the thermometer. Then turn the thermometer on and have your patient positioned on their back with their knees bent. Then insert the thermometer into the rectum about 1 inch. Then remove the thermometer once it beeps and read the temperature measurement. After reading the temperature, take the probe cover off, clean the thermometer, doff your gloves, perform hand hygiene, and document. Another way to take a temperature is through the skin using a temperature strip. And to do that, you want to perform hand hygiene, peel off your strip, and put it on the forehead. And after placing the strip within 15 seconds, a dot will start to appear, and whatever turns green will be the temperature reading. Then once you have read the temperature, just take the strip off and dispose of it. Then perform hand hygiene and document. Now you may be asking yourself, which route is the most accurate? According to the experts, the rectum is the most accurate route to take a temperature. The least accurate route would be the skin or the armpit. So always use that as last resort. And whenever you take a temperature in the rectum, it's always going to read about a degree higher than the mouth. And if you take a temperature in the armpit, it's going to read about a degree less than the mouth. Thank you so much for watching, and don't forget to subscribe to our
Okay. Anything new that you learned from that informative video? Besides, do you think she told her husband, like, okay, now stare to the left. Now stare straight ahead. Now stare down.
I've taken a lot of temperatures through people's ears, and I have never yarded on an ear like that.
No, especially the kid. It was like, did you see his head like jerk to the side? Maybe she was mad at him. Maybe he didn't clean his room or do his homework or something. Yeah, the strips. Sometimes they'll actually use the strips in the operating room, like some anesthesia care providers like to put the strip on the forehead. They'll like put it upside down so that they can kind of monitor the patient's temperature throughout the procedure, but otherwise we don't really use those too much. Probably not as accurate. And you notice there's only like a few different readings on there, so you're gonna get an ish. I was thinking when I saw it, I was thinking of those mood rings. Remember those mood rings? It's probably the same exact premise. You know, it just goes off your body heat. So probably a little less accurate than all of them would be my guess. because through the skin is a little less accurate anyways. You're not getting an exact reading. Yeah. Any other comments or, let me see. Yeah. Yeah, the disposable ones are not that accurate, I'm sure. Let's see. So don't forget to bring your workbook to lab. Vitals start on page 156. So let me turn to temperature. Temperature is 161. So you'll need to be able to describe the normal temperature range, and then indicate like the differences in temp range. The supplies will be there, but yeah, and then I'll have a little sheet where you can document each other's vital signs. Okay. I think we're going to be using like the completely like touch-free ones because those are the ones that the school has, but I got to go there today and get the lab ready. So it'll either be the ear one or the non-touch one will be the ones that we're using probably. Okay, so any questions about taking a temperature? We will not be doing rectal temperatures in class, okay? Don't worry. Okay. Just wanted to put that out there. All right. Rest assured. Okay, so next we're going to look at, no, we're gonna do a bunch of other ones too, Alexis. We're gonna do temperature, pulse and respirations, blood pressure, pulse ox, and placement of EKG leads. And those last two are not checkoffs per se, but they're things you're gonna see in the operating room. So once we do our little vitals lab on each other, we're gonna come into the lab and then using the mannequins, we'll practice putting on the 3-lead EKG leads and the pulse oximeter. Okay, just so that we have an understanding of what it kind of looks like in the operating room, and maybe we'll practice putting on the cuff, because if you're assisting the circulator, that may be something that you're doing, helping put on the EKG leads, the pulse oximeter, the blood pressure cuff. So we'll practice those things on the mannequins. Okay, does that make sense? Okay, there's just no good videos out there, so I'm just going to apologize before this one even starts that, you know, this individual is a little interesting as well. Just more encouragement for me to make my own videos. Not that I'm any less weird.
Good afternoon. My name is Dr. Ellen Katzowitz, and we are doing a preview video for Medical Science 101. I will be your instructor throughout this course, and we will be demonstrating pulse today. Are you ready?
Mm-hmm.
Make sure your equipment is assembled. I have here something to write on, a sink to wash your hands, hand sanitizer, which is a must, and a watch or a stopwatch. You can speak to your patient and introduce yourself. Hi, I'm Dr. Katzowitz. And what is your name?
My name is Edie Wilson.
I will write that down before I forget, and then I will tell the patient what you will be doing. Now it's time to take a radial pulse. Make sure you find the radial bone and run your fingers along until you feel a pulse, making sure to put a little bit of pressure. When that is done, turn the hand over. Make sure you do not take a pulse with your thumb. You're going to count for 1 minute. Not only are you counting the pulse rate, but you're also noting the rhythm and the volume. When that is complete, you record your data. Ms. Wilson has a pulse rate of 61 BPM, beats per minute. Her rhythm is regular, and her volume is strong. Make sure you check the patient before she leaves and make sure that everything's okay. Is everything okay?
Yes, it is.
The last step is to, again, use hand sanitizer so you could get to your next patient. This concludes the video impulse.
Did she forget what video it
Respiration
was?
is another vital sign that we must measure. It's kind of like a continuation of pulse, sort of, but you need to wait and see. Now, the patient still
You need to
thinks
wait
I'm
and
taking
see.
their pulse, but I've quit taking their pulse. Now I have to determine what their breathing rate is. So I'm going to look at their chest. But why do you do this? Well, think about it. One of the reasons would be that if a patient knew that I was counting their breathing, like, I'm counting your breathing, their breathing would more than likely alter. Therefore, you don't do that. You continue to make the patient think you are taking their pulse. Clever. You count for a minute. You're watching the chest rise and fall, one inhalation and one exhalation. If you cannot see this happening, make sure you either put a hand on their back or their shoulder. Counting for a minute, noting their rate, rhythm, and volume.
For more information about our program, contact us at esquaredhomeschool.com.
Okay. What did you guys think about that one? What kind of rating do you give her?
10 out of 10 for acting.
At least the assistant patient was more, like, I don't know, alive. Jacob says a -2.
I thought that's where we were rating.
Okay, so what about a normal adult pulse? What are we looking for normal adult pulse? If you need a chart, there's a nice one on page 85. $60 to $100. Yes, that is the range. $60 to $100. What about for 0 to 1 years? Yeah. About an average of 120, right? We're looking for. So somewhere in the range of 70 to 190-ish, depending. 70 to 190 for a newborn, and then 80 to 190 up to 1 years. Okay, so what about normal adult respirations? What's the range we're looking for there? $10 to $20, yep, $10 to $20 for our respirations. And then what about for our little ones? 0 years and 1 years. Yep. The textbook says for 0 years, it's 30 to 40. And for 1 years, it's 21 to 40. So a little bit faster heart rate, a little bit faster respiration rate for the little ones. Okay. All right, good. Questions about taking pulse and respirations. When we do it in the lab, we'll just take the pulse, or, at school, take the pulse. We have, if you don't have a watch that has a second hand, you can use your phone, or you can use the clock in the classroom has a second hand as well. The first minute we'll do pulse, and then just keep holding pulse for that second minute. We'll do respirations and record. Okay. All right, questions or comments about that? We got temp, we got pulse and respirations. So blood pressures, and I was just talking with the other Surg Tech PDs about this, because the checkoff that we have uses like a stethoscope and a sphygmomanometer and does like a manual blood pressure. We will not be doing that. I confirmed with them that they have never taken a manual blood pressure in all their lives, and we probably have 100 years between us, between the three of us, anyways. So we'll be using electronic blood pressure device. So what is the normal adult blood pressure? Average, normal, whatever we want to call it. Let me see Ian's question. Yeah, I think so, Ian. Yep. 120 over 80. Yep, you got it. You got it. All right. Good. Okay, so we're gonna watch blood pressure on that. It's pretty simple. It's just kind of point and shoot. So let's watch that really quickly.
The following video will focus on best practices for taking an accurate blood pressure reading while using the Connex Vital Signs Monitor. The patient should be seated and at resting state. When applying the cuff to the patient's arm, use the range indicator on the cuff to determine the proper size. If 2 cuff sizes fit the patient, use the larger one. Cuff sizing is based on the circumference of the patient's arm. To determine proper fit, the brachial artery marker should fall within the range indicator. Shown here are 2 blood pressure cuffs, sizes 11 and 12, as an example. It is important to point out that inappropriate sizing of the cuff can lead to erroneous readings, so proper fit is key to obtaining an accurate measurement. Once you have made your cuff selection, place the cuff on the patient's bare upper arm. Align the artery marker on the cuff to the brachial artery as shown. Apply the cuff snugly, allowing room for no more than 2 fingers. Once the cuff is properly applied, check to make sure the patient is correctly positioned, and check the hose and cuff to ensure good connection. Ensure the blood pressure hose is not moving or swaying. The patient's upper arm should be at heart level. Their back should be supported, with legs uncrossed and feet flat on the floor. Ask the patient not to move and remain quiet during the reading. Conversation should not occur during measurement. Once the patient is fully situated and the cuff is applied, press the start button on the NIBP tile as shown. The cuff will inflate and take a measurement. The results will then appear on the NIBP tile located on the device screen. This now concludes the training video. For further questions,
Pretty easy. Questions about that? Okay. Let's go ahead and take our break right now, and then we'll come back and look at pulse ox and the 3 EKG lead placement. All right, so I have 8:41, so how about we'll come back at like 5 till 9. How does that sound? All right, I will see you at 8:55. "96, Rainey says. Anybody else? above 95. Those are all great guesses. What anesthesia is going to want is 100% oxygen saturation before they actually give anesthesia. All right, so they're going to administer some oxygen through the O2 mask, and they're going to wait until their O2 sat is 100% before they actually do anything. Okay, yes, but on normal room air, just coming into the clinic or vitals or whatever, everything that you guys suggested is perfectly acceptable. But in the operating room, we want them to be 100% saturated before general anesthesia or anything fun like that. All right. Okay, so let's watch this, learn about this pulse ox thing then. My cursor, okay, here we go.
What's up, guys? In this video, we're going to discuss pretty much everything there is to know about pulse oximeters. Are you ready? Let's go. So since you're here watching this video, you may be wondering what exactly is a pulse oximeter. A pulse oximeter is a device that is used to quickly and easily monitor a patient's oxygen saturation. This means that it can measure the level of oxygen within the blood, specifically in arterial blood, without using any invasive means. It is typically a small portable device that clips onto the finger and provides a reading within seconds. And in addition to monitoring oxygen saturation, the device provides a heart rate measurement as well. Arterial blood flows to parts of the body from the heart, fresh with oxygen, where it diffuses to the surrounding tissues and cells. And if there is a lack of oxygen in the blood, that means that your body tissues will not be oxygenated properly and can be hazardous to your health. This can be an indication of serious pulmonary issues. And that is why it's so important to use a pulse oximeter. Respiratory therapists, as well as other healthcare professionals, use these portable devices to constantly monitor their patients' oxygenation levels and their heart rate. And these vital sign readings help provide a better understanding of the patient's overall cardiopulmonary status. And in some cases, it is also recommended that patients with cardiopulmonary problems keep their very own pulse oximeter at home. So if that's you and you're looking to purchase a pulse oximeter, I put a few links down below to some of our top recommendations. So how exactly does a pulse oximeter work? Pulse oximeters work on a simple but brilliant principle. So basically, the pulse oximeter shines a light through your finger, and by doing so, it can measure the amount of oxygen that's in your blood. Blood absorbs light, and there's a distinct difference between the wavelengths that go through oxygenated and deoxygenated blood. The finger clip of the pulse oximeter consists of a transmitting light source that emits a broad spectrum of light. And on the other side, there's a receiver that measures how much light passes through the finger. The diode on the receiving end is capable of detecting the wavelength of light. The internal circuits and processing components of the pulse oximeter do some calculations as well. That is because the device has to compensate for ambient light, so for example, the light in your room or from the sun. It also has to compensate for the size of the finger and for the absorbance of the rest of the tissues. The device has a reference curve that is saved into its memory, and it uses this as a way to calibrate incoming readings and to normalize them so that you can get an accurate reading. And this helps to increase the precision of the results that it provides. So what does a pulse oximeter measure? Now, as we mentioned before, a pulse oximeter measures the oxygen saturation in the blood, and it gives a heart rate measurement. And when I say it measures the saturation of oxygen in the blood, I'm of course talking about arterial blood. More precisely, it measures the amount of oxygen that is being carried by hemoglobin. and this reading is known as the SpO2. So the primary function of a pulse oximeter is to measure oxygen saturation, and by doing so, the heart rate is automatically calculated alongside of the percentage of oxygen. So heart rate and oxygen saturation complement one another, and doctors and respiratory therapists rely on these readings to know how to properly treat their patients. So if you already have a pulse oximeter, you may be wondering how to use it. The best part of pulse oximetry is that it's not invasive. Back in the day, doctors had to draw blood from the patient and perform several tests in order to find out the percentage of oxygen saturation. Now we can get that reading in a matter of seconds by using a pulse oximeter. All you have to do is clip the device on the middle finger or on a toe or even on an earlobe. Some models are even surface probes that can attach to the patient's forehead or even their chest. And once the device is attached and turned on, it will provide you with the readings in a matter of seconds. But to get reliable, realistic readings, you should try to minimize the patient's movement as much as possible. And also, if you're using a fingertip pulse oximeter, make sure that you're not wearing any nail polish if you're using it on yourself. Or if you're a medical professional, make sure that the patient does not have on any nail polish as well. And another question that I hear quite often is, which finger is best for a pulse oximeter? If you didn't know, accuracy is often the biggest concern when it comes to measuring oxygen saturation with a pulse oximeter. Some studies were performed, and it actually showed that the middle finger of the right hand gives the best accuracy. And surprisingly, the thumb of the right hand came in second. This is a bit of a surprise for doctors, respiratory therapists, and medical practitioners because the same study showed that about 80% of healthcare workers tend to clip the pulse oximeter to the patient's index finger. But with that all said, the differences were negligible, and any finger, as long as the device is secure on the finger, should give you an accurate reading. But if you had to choose, you can always go with the middle finger of the right hand. And since you've made it this far, you may be wondering, can you purchase a pulse oximeter on Amazon?
Okay, well, we don't really care about that. Okay. What did you learn about pulse oximetry? Tell me some things you learned, some takeaways.
I didn't know how the blood oxygen level was measured before the pulse ox machine.
Awesome. Very good. Good. Learning's happening. No nail polish. Yeah. The ones nowadays will work if there's fingernail polish, but they do work better without it. So anesthesia usually keeps like some little, they kind of look like the little squares like alcohol swabs, come in, but they're actually for removing nail polish. So if the pulse ox isn't working, if they're super dark polish, then they can just quickly remove that. Yeah, but no nail polish is best.
I
Good
didn't
takeaway.
know
What else?
that it was.
I'm sorry, Jonathan, I
didn't
didn't
know.
catch it.
I didn't know that the light was actually used for the measurement.
Pretty good, huh? Yeah. Very good.
What about artificial nails?
Artificial nails are okay, I believe, just the same premise as long as the polish on there isn't super dark. Should be okay. Yep, good question. Middle
Did I
finger
miss
being the most accurate. What? I'm sorry.
Oh, did I miss it, or did he not mention that if a patient's hands are really cold, that it's going to be really hard to get a good reading?
He didn't mention that.
Okay. Because, we've had it where we've had to like really work at warming the patient's hands up and what have you to try to get even a reading, let alone an accurate one.
Yes, that is definitely true. That is something that he didn't mention in the video, that if the hands are really cold, we might not get a reading on there. Sometimes they'll take a warm blanket and like wrap their hand up or something like that, if that's the case. Yeah. Yep. Good point. Thank you for adding that. Ian. Yeah, they said that it's negligible, though, the difference. So still probably getting a pretty accurate reading. They'll do another study in 2 years and say that the index finger is the best one. So just wait, it all comes back around. Depending on who does the study. Anything else? Yep, it is. Medicine's like fashion, just depends on what's in vogue at the time. Yep. So typically the one that we use in the operating room isn't cordless. It has a cord to it. Not like the one that they were showing in the video that looks more like a portable one. Trying to think what other differences there are, but yeah, pretty much the same. Any other questions or comments about pulse ox? Something else that they measure in surgery is the level of carbon dioxide, and so that's called capnography. And the way that they do that is there's a special little tubing that comes off from the ventilator hose and goes back to the capnography machine, and that'll measure the level of CO2. So anybody know what it might be a sign of if CO2 keeps rising and O2 goes down? What that might be a sign of? Has something to do with the patient getting very hot. No guesses?
Is it CO2 poisoning?
No, good guess. Yeah, hyperthermia. You got it. Malignant hyperthermia, right? So some anesthetic agents that the anesthesia care provider will use can trigger malignant hyperthermia. That's going to be a sign. That might be something that they notice first, because we don't typically monitor temperature in the operating room unless they put one of those sticky things on the forehead, which they don't do routinely. So increasing CO2 is blow off is what they're going to notice first. Right, Rainey, you're absolutely right with the blood pressure. We don't want to take it on the same side where patients had a mastectomy. And so that was a thought that I had that you just triggered in my brain. Let's say we have a situation where patients getting something done on the right arm and they've had mastectomy on the left arm, then we'll put the blood pressure cuff on the ankle, more than likely. Yep, very good point. Good. Any other thoughts before we look at EKG lead placement? Okay, that is the last thing on our list. And that won't take us very long. I couldn't really find a great video. Most of the videos that I found were for 5 and 12 leads, which we don't do in the operating room. We just use this basic 3 lead placement. At least that's been my experience. So you might be, if you're turning over the room, there is a specific way that we set up the anesthesia stuff, like, and sometimes you might be turning over stuff in the anesthesia machine, like the circuit and replacing the little pads for the EKG leads, those kinds of things. And we typically put the 2 on the left, you know, over the bed, hanging on the left side, and the other one on the right side. Typically we have a red, a black, and a white. So the way that I remember it is white on the right, and that's going to go subclavicular here, and then On the left side, I remember smoke over fire. So if you can remember white on the right and smoke, black, over fire, red, then you will remember how to place the leads. So again, the white on the right goes just under the clavicle on the right side. The black one is going to go just under the clavicle on the left side. And then the right one is going to go down on the left side of the patient. All right. So if you're setting it up or if you're placing them, this is what you need to know. If the patient is really hairy, if they're really sweaty, if they're wet, if they have a rash, those are all things that we need to look at. We need to look at the skin integrity. And then if they're super hairy, they might need to have a little shave before we place the leads. Okay, so once the patient gets, unless they come from ICU where they're, well, that's not entirely true. I think in some facilities, what they do now is in pre-op, they will put on the EKG leads, the pulse ox, the blood pressure cuff, and then that part of the machine will pull out and go with the patient, and then it will just dock into a system in the operating room. So I don't have to take things off and put them back on twice. But sometimes you might have to. So, you know, if that's the case and the machine doesn't come with them, then once they get moved over onto the bed, besides getting them on the bed, getting the strap on them, getting the arms out to the side, getting them strapped down, we're going to be putting on pulse ox, blood pressure cuff, and EKG leads. All right, and anesthesia typically does that, but it's definitely within our scope. Okay, questions about this? I'm going to stop sharing. Any questions about that, putting on the EKG leads? Nothing? Any other questions at all over what we've talked about as far as vitals or taking vitals or anything like that?
Isn't it true with the blood pressure cuff, you also don't want to put it on the same side that they have an IV on?
Yep, definitely true. Yep, because that can compress the vein, and so the IV won't flow properly. Yep. Right. If there's any sort of graft over there, you don't want to put it on either. Yep. All good questions to ask and consider.
So are these things that we should ask the patient, or, I mean, obviously certain things should be documented in the chart if they've got a history, but, you know, just how would we go about ensuring that that's done properly without putting them at risk?
I would say that if you are in the operating room and you're helping with that stuff, just ask anesthesia or ask the circulator, is there any reason I can't put the blood pressure cuff on X arm, you know, which would be the one opposite the IV, because pretty much in every situation, very rarely does a patient not have an IV when they're in surgery. So, you know, you can just double check, you know, just like if you were going to put the Bovie pad on, you know, you can ask the circulating nurse, hey, you know, is it okay to put the Bovie pad over here on the right hip, you know, as long as the skin integrity looks good. So that's what I would do. Great question. Yep. If you're in some sort of non-traditional setting, then of course, you know, you're going to have to pilfer through the chart to see or ask the patient to confirm anything. Let me look at Ian's comment question. Yeah, sometimes the electric cuff can be kind of crazy, especially if somebody's blood pressure is super high. And I just know this from my mom has a history of hypertension and atrial fibrillation. And sometimes her blood pressure does not even register. It just says error because her blood pressure is so high and there isn't a normal rhythm, and it'll just say error, or it won't register, or it'll give something weird. So yeah, so the best thing to do if that's the case is reset it, unplug it, plug it back in, start over, stop it. We had ones when I worked in labor and delivery, I think the things were like halfway possessed or something. Like they would just start taking the pressure on their own. And then you're like trying to put the cuff on the patient and it's starting to inflate. And you're like, what the heck? Yeah, I think if they can't get a reading then, or the thing is wonky, then manual's gonna be the way to go. Yeah. Good questions, comments. No way, Ian, that's so weird. Yeah. Yep. It could have been a ghost. I swear there were ghosts in the labor and delivery where I worked in Tucson. Like I went in one of the things I would do when I'd get there at the start of my shift was if there was any instruments, I would go put them away. And the instrument storage was at the end of this long hall, and ORs were on either side, and so were scrub sinks. And the scrub sinks were all like those no-touch, like automated ones. And and the hall was super wide. Anyways, I push the table down the hall and I'm like offloading stuff into the sterile storage, and I hear something. And so I stepped out into the hall and I look, and like one of the scrub sinks, the water is going, and then it stops, and then water starts going on the other side, and then I ran. I got this really creepy feeling. I went to the nurse's session. I'm like, the sinks are turning on by themselves back there. She's like, yeah, they've done that before. She's like, we think we have a ghost that lives back there. I'm like, interesting. Okay. That was creepy. All right. Any other questions or comments about this? I think that's really all that I have for you today. Honestly, there isn't much else that we can go over. We could dig into some new material, but I think it's probably best to just stick with what we have, and then we'll look at that new stuff when we start our next class. Okay, so let me give you let me show you really quickly so you'll know what the website looks like when you get there to do this little Vittles quiz. Okay, hold on one sec. Let me, so this is what it looks like. I'll put the link in there. There's 27 questions about vital signs. So when you get to this landing page, you'll just click start. And then for each question you submit, and it'll tell you if you got it right or not. You'll go through each of the 27 questions. And then at the end, it'll give you, and it'll tell you like if the answer is right each time. And if it's not, it will tell you that as well and show you the correct answer. And then once you get done with that, it'll give you a little it'll show a certificate with like your score if you'll just take a snapshot of that and then upload that for your activity. Remember to do that because that's the only way I can give you attendance credit for today. So make sure that you do that. And then let me just copy this so that you guys can copy it and put it in the chat here. Okay, so grab that link.
You said for our activity?
Yes, sir. That's going to be for your activity. Okay. Let's see, what else? Andrea, are you on here?
Yeah, I'm right here.
Okay, can you stay on afterwards for just a couple minutes?
Yeah.
Okay, sounds good. All right, you guys have any other questions or comments before I leave you to your own devices? No? Okay. All right, well, short class today. Thank you for your participation. I appreciate it. And then I'm looking forward to seeing you in class tomorrow, those of you. That's all I got. All right? All right, let me know if you need anything. Have a good afternoon. Be safe, okay? Thank you.